Doctor. Welcome to the quick chat show organized by Prabisha Startup Network.
Good evening.
Good evening, viewers. For your benefit, let me introduce Dr. Senthil Murugan, a famous maxillofacial reconstructive surgeon from Chennai. A warm welcome, dear doctor. He is associated with an organization called Dvijana. Dvijana is a unique organization started by doctor with a prime focus on training the fellow maxillofacial surgeon in the field of reconstructive microsurgery, and also providing immense scope and facilities into dental clinic, maxillofacial clinic, and research and training. Due to pandemic, a lot of changes have come, and we have observed it in many fields. And definitely, medical field is also not, spared. So let us hear from doctor his challenges or how he has overcome this situation. So if you are ready, we can go ahead with the quick questions.
Yeah, sure. I'm ready.
All right. So how was work and life changed for you during the pandemic?
Yeah, it was a real challenge for everyone. As far as my part is concerned, it's even more challenging. There are so many issues that we came across. So one of the challenges is all the patients. We predominantly operate only on the patients with oral cancer. Okay. So what happens? Those patients, like other, let it be like uncontrolled diabetes, cancer patient will also have some kind of deteriorated immune mechanism. So that add some more intricate part of the treatment when it comes in the same patient getting affected with the COVID.
Yeah,
and all the patients, all these patients, what happens? They are all downtrodden people. So they can't afford to undergo the primitive treatment even at the earliest stages, unlike the other countries.
Definitely.
So what happens? All these patients are subjected for screening for COVID. Apart from the cancer screening, we have to subject the patient for COVID so that we can take a safety measure from the surgeon's point of view, as well as for the other patients, those who are already in the hospital. So when those kind of things happens, so additional expenses are bestowed on the patient's head once again, and that is the major challenge we face.
I know, and it has been a long, like 2 year long. I think this would have been a prime area where in fact, suffering is there, and apart from that, if the long process, definitely COVID testing is also not a very kind of a very easy thing. So double the thing, patient would have suffered.
So that is the one. And the second challenge is cross-infection control. The patient should not contaminate the surgeon as well as the neighboring patients, those who are already healthy in the hospital.
Correct.
So these are the basic challenges that we faced during the pandemic. And that 18 months was a dreadful time. So we were all on shoes always. And fortunately, we are all blessed with a good immunity, I believe. So we have a considerable amount of good outcomes. So already patient is reporting to us with a little advanced state of cancer, oral cancer. And they are again sent for those other advanced investigations to take up for surgery. So once again, that prolongs the process. So it is unlike other patients, normal patients without COVID, take with oral cancer, we can immediately post the patient for surgery. So when it comes for another 1 week is added to that. By the time cancer has got little progress to the next level sometimes. So these the two challenges really, we had a lot of issues that time.
I can understand.
Of course.
The whole lot of challenges and during this time, hope that this time is goes over swiftly and you can carry on with your practices. Beyond the challenges, let me also come in brief discussion about the things what you have to offer. So which is the most difficult surgery apart from all the pandemic related challenges, according to you, which is the most difficult surgery you came across your entire career into the maxillofacial surgery? Can you brief us?
Difficulty is not actually technically we did not face any difficulty at all. So passion feeds interest, interest feeds, gain knowledge, and we sharpens this. We keep on sharpening the skills often. So challenges on the from the patient point of from the patient perception. They expect the surgeon or the doctor to give back the originality as it is.
Correct.
Like, however, they come inside, they have to go back with the same kind of uh, face and the outcome, which will not happen at all. Even a minor scar can't be done, reversed by a doctor or a surgeon, whatever it is. So
A
the
very
patient
minute
expectation,
surgery, right? And
yes, yeah, and they
technically,
expect, the undue expectation from the patient side. They expect once the patient is touched by the doctor, the Midas miracle will happen, and they will come back to the original face, whatever they had before surgery, which is not going to happen. And most of the patients, 90 plus percentage of patients, will report to us with extensive damage to the face. So definitely, we need to go for extension for prevention, even if it is normal tissue that has to be sacrificed apart from the cancer tissues. So definitely that land up with a huge defect, which will be reconstructed uh, using the tissue obtained from the normal anatomical site, like thigh or chest or hand, whatever it is. We replace that. That's it.
so it is
Just give a
how long, to be brief, like a procedure would take for how long, or how
not less
quickly?
than 8 hours.
Pardon?
Not less than 8 hours. Not less
Okay.
than 8 hours.
Okay. But how
So
many
it
consultations would be, on an average, basically required? Like minimum, you can give a gapping or a range between maybe 1 month or 2 month, how it is.
initially for 6 months you have to every 2 weeks you have to examine the patient. You have to see the
Okay. Okay.
patient. That's
Because
very
it's a very
important.
minute changes, right? Definitely, it
Yes, yes,
requires a
yes, yes.
lot of
First
follow-ups. Yeah,
first
I'm just
14 days are crucial period.
I think the viewers should also be, benefited out of what,
Yeah.
the things or the awareness, because it's a very untouched area, if you could say. No, not many people are aware of maxillofacial surgeries. Yeah, it is there, but definitely it is not like the other fields. So
Yeah.
I think a lot of insight can be shared today.
Yeah,
So,
of course.
moving to the further, I would like to know what are the facilities your hospital basically provide, and what are, people know about oral cancer, and how that can be, treated, or maxillofacial surgery, how it can treat it. Yeah.
Yeah, I hail from Savita Dental College Hospitals. We
Okay.
have a 100-bed hospital
Mm-hmm.
with atmost all facilities. Though you name it, we have everything there. We have a poor patient feed funds,
Mm-hmm.
and right from the basic CT scan investigation with advanced radiation chemotherapy unit, we
So
have that.
basically, they don't have to go anywhere. So all
No,
the
well, all under one
the
umbrella. Yes,
facilities,
exactly,
modern
exactly,
technology.
exactly. Irrespective of the financial standards,
Mm-hmm.
status, we have all kind of facilities. We never leave the patient without giving any treatment at all. That is the one. The
Okay.
second is
So,
we are focusing more on the preventive part, prevention part. We keep on educating the patient, attenders, how the patient is going to be after the surgery, or what are the things that is going to happen in the family members if they don't follow the proper basic discipline. And
okay.
we keep on giving advices for tobacco prevention, all those causative and predisposing factors, which
So
is
campaigns
enhancing the
are held
formation of
on
cancer
regular
cells.
basis.
Yes, yeah, yeah,
Very good, very good. So, coming to because it's a very expensive matter. So, what kind of a provision your hospital is providing for the poor segment? Basically, people from, coming from Bengal, Odisha, Jharkhand, Bihar, and all. Is there any kind of a particular, special package, or, in general, you have a separate thing for that?
yeah. We have a poor cancer patients relief fund is there. From the management side, Savita is providing full support for all kind of patients. There is no compromise in the quality of treatment, irrespective of the financial status of the patient.
Okay.
As I said, few places really, they hail from very low economic standards with advanced oral cancer. We
Okay.
every month you are operating at least 20 25 cases. only on purely on oral cancer patients.
Very, yeah.
And not all the patients, except one or two, rest of the patients are really poor. They can't afford to take their basic medicines. So those kind of support is given by the management. They have that relief fund for the patients. They feed food for the patient. Along with that patient, the attendant can stay for until the patient is getting discharged. Both of them are paid for the food also. So
Okay.
they feed them, they treat them, and even the radiation and the chemotherapy, everything is getting covered. Per patient, at least 1.5 to 2 lakhs are spent by the institution, where the poor patient
Very,
also get benefited out of it.
very thoughtful, and in fact, definitely this would, help more, because oral cancer is a very common thing, and we do have a lot of cases in India,
Yeah.
particularly, where, in the basically the eastern countries, where people are not aware of, how much they consume good cars and these kind of things. So, which is definitely something which is related to it. So hope in future definitely you will have much less numbers when treatments are on, more campaigning is done. Yeah. The news are spread across, and you have a very thoughtful thing to be done with the people. All the best wishes, sir. All my heartfelt wishes. Also now, apart from helping people, I would like to know something related to how, you have research and training. So do you have people, doctors coming and doing a certain internship, or are you providing some kind of a provision for research and training in your hospital? You do have training
Yes,
there.
of course. Of course, we have various levels of training program research projects
Mm-hmm.
based only on oral cancer and maxillofacial surgery.
Okay.
Right from the third year undergraduate students, they are involved. They are encouraged to do those kind of research projects.
Mm-hmm.
Number one.
Okay.
Second is once that awareness has come among the student society, it will transfer to the next. It is contagious to the next level of thinking. So based on that, the reconstruction is the challenging part in any part of the world. Since we take flaps, different tissues from the different part, and augmenting filling the gap which has been created by the ablative surgeries. So stem cells is the upcoming field which is really helpful for the patients to alleviate these kind of extensive surgeries. The stem cells are really working out on that, in which we have lot of refinements on this
Mm-hmm.
regenerative medicines, tissue engineering, obtaining from the
Yes.
different
Very
individual of the
upcoming
same
thing.
species.
Mm-hmm.
So those things and all getting popularized based on the research. So when that comes, that is the one. The second is when they come for the post graduation. After post graduation of maxillofacial surgery, we have a 2 years program and 1 year program respectively. So what we do for them, we are we are give enough training for on the models, animal models, as well as for the cadaver, dead body. So once they start doing that under the supervision of an experienced doctor who is there, and they are allowed to execute on the patients. So we are sure that at least 100 patients are getting treated with the eminent faculties aside, and the beginners will be starting doing the surgeries on that. They will be the 1 year span of time. What they do is they do not only do the surgeries, they see what are the post-operative changes happen in the patient. Very important. Post-operative care is the only challenge. Anybody can operate on a patient, but what will be the post-operative outcome? How
Yes.
the results are going, how the patients are going to lead his rest of his life. Those things has to be observed. So
Okay.
that observation period is also given in this part of training. So
Okay.
that is the one of the advantages of this.
That's good to know. So maybe, somebody who is definitely looking forward for, PG after MBBS, definitely they can have a good kind of a reference to look into. Um, Hope, apart from, doctors, you are also having some provision for the nursing and for, lab related. I mean, other facilities
Yes,
are there. Do you have other people also coming in apart from the doctors for the training?
yes. Of course, we have.
Okay.
We have a preclinical lab. We call it as
Okay.
preclinical lab. Before
Okay.
clinic, the students are entering. The
Mm-hmm.
students as well as the staff nurse, those who are getting trained.
Okay.
This kind of oral cancer treatment require a special training for
Okay.
even the staff nurse. So not the basic staff nursing is enough. That qualification helps to enter into the field. However, we need to train them in a specific area.
Yeah.
Cancer is a different ballgame altogether. So they have to know what kind of emergencies that can be anticipated and how to overcome that, how to solve that issues. So that kind of training is given not only for the medical graduates but also for the nursing staff,
Other staffs,
staff.
allied
Yeah, yeah.
staffs. So it's
So they will
basically a
come to know.
hands-on training for them, what you
Yes, yes,
provide
yes.
them before you're,
Exactly,
taking for the job role. Yeah. So
exactly.
I think definitely, people will be having much benefits, and hope, this word of mouth is spread across, so that people are, more aware of your Dvijan drive, which you have, started with such a noble cause. Um,
Yes.
and of course, with future people who are associating with you, let the campaign be spread more into the different remote areas, so that people are more aware of the, preventions. It's always better to say that prevention is better than cure. So unless they come into such thing, before that, if they have some preventive, would you like to share some kind of a tips to, quickly to, I know cancers are never avoidable. I mean, nobody has got to say, but still, there is something which they can curb, take a step before, coming into such kind of a infection or whatever. Is there something which you would like to share at this point?
Yeah, certainly, because any disease can be prevented, including the inherited disease from the family, suppose diabetes or whatever it is, this can be prevented, can be postponed to, as long as we can. In such way, this cancer patient, the world number one, is the anticipated rank for India to become. So very short period, within 5 years, our country can, will be leading for oral cancer. So this can be prevented, especially oral cancer can be really prevented because we know the cause, what is causing that. All tobacco products are used directly or indirectly. Second is lifestyle changes. The third is predisposing factors. Apart from the cause, there are some predisposing factors. What are the predisposing factors? The dietary intake really, completely changed, especially the southern part of India, northeastern part of the country. The completely changed way of dietary intake. So these three things, if you remember, yes, one is sharp tooth. The tooth which is pricking the tongue can cause cancer, oral cancer. That has to be periodically checked by the dentist. Periodic visit to the dentist can prevent it.
Okay.
Second is smoking. Smoking, as we all know, lung cancer as well as the oral cancer are predominantly caused by the smoking. Third is your what is a syphilis kind of infection. Nowadays it is getting reduced, but still that is there. The fourth is the style of living. That's lifestyle changes. As I said, higher the fiber intake, the food dietary fiber intake is high. The chances of getting the free radicals, which is causing cancer, is completely eliminated from the body. So that is the one. So these are all the
Factors which people can definitely
factors
keep in
which is,
mind.
yeah, definitely that in my opinion, instead of the government is picturizing uh, the photos of the pictures of the oral cancer patient, they should post the type of surgery we do. So that would be really scary for them, that really want the consumers for that, instead of
I
taking such a huge lesions. Of course, that is important, but still, if they post along with that, if they post the surgical, what kind of extensive surgeries they are doing, and what are the functional disabilities that they face after surgery. When they
Yes,
come to know that,
that is more
definitely,
important. Yeah, then so that people
yeah,
will be at least, before doing that repetitively, at least they will
yeah,
be aware ki, okay, this could happen.
yeah,
Great thought, sir.
yeah.
Definitely, I hope all the viewers here who is watching it, definitely, take a note of it and share maximum to your friends and relatives, so that we can have a better India in at least in the upcoming days.
Healthy India.
Yes, definitely, sir. And thank you so much for your, all your valuable insight and the precious time you have taken out from your busy schedule to put a light across to the audience. And also wishing you all the very best for your future
Thanks a
endeavors.
lot.
And have a nice day. We will connect soon so that people can get more benefits out of it. All right, sir. Thank you so
Thank you very
much.
much. Thank you, Prabisha and team, and thank you especially to you for
Yeah, sure, sure.
sharing
You're
such a
most
wonderful
welcome, sir.
interview.
Yes,
Good day.
thank you.